When it comes to hair restoration, not everybody's a candidate for surgery, nor does everyone want surgery. And so we have non-surgical options to offer them. 3 of them are FDA approved, and we should cover those first. Propecia, which interrupts the testosterone progression to a byproduct that causes hair loss, is the probably number 1 prescription used for hair loss. It is something which has come with a lot of controversy, and my recommendation to patients is that they review everything online. There's been some issues with it related to libido, and it's sometimes, I think, real and sometimes not real, but it's important that you're totally versed in its side effects before you embark on Propecia. I have probably over 1,500 patients in my practice who have used Propecia without consequence, but I still am cautious in prescribing it. The second is Rogaine or minoxidil, and Rogaine is now over the counter. You can find many different types of Rogaine, and what Rogaine is best at is stabilizing hair loss. Not necessarily growing new hair, but stabilizing hair loss, and I think that it works synergistically to a certain extent with Propecia, and I think we've seen it help a lot of people through the years. You can't recommend Propecia to women. It doesn't affect that hormonal pathway in women, but you can use Rogaine. So as far as medications, it's really the only thing that we could use for female pattern hair loss. The third thing, which is laser treatment, I was quite skeptical about. And my nature is not to jump on the bandwagon with everything that comes along. But this is where we use laser diodes, whether they're impregnated in a hat or in a brush. And laser therapy has been shown to improve wound healing and growth of different things. And so here it's used primarily to help with hair growth. And at first I was a little bit skeptical. It then got FDA approval, and so in order to get FDA approval you have to go through rigorous testing. And now there's many companies that offer laser caps, which is something that looks like a baseball cap that has multiple laser diodes, red laser diodes in the inside of the cap. You wear it for about an hour a day. About half the patients in my practice that use them really swear by them. And so that is the 3 things that are FDA approved. Then there's PRP, and PRP stands for either platelet-rich plasma or protein-rich plasma, and it's where we use your own blood. And so we actually draw some blood from you, spin it in a centrifuge, and separate the red blood cells, white blood cells, and then the supernatant, the top portion, which is this PRP, protein-rich plasma. And there's all kinds of research now around what is in there. And we know that there's growth factors. We know that there's some things that help with stem cells. There's all sorts of rich ingredients to this. And finally, there's a whole grab bag of things which are known to help with hair growth, whether it's zinc, that's crucial to making keratin for the hair itself, or whether it's biotin, which is involved in that same process. There's many things that people use that are secondary. There's hair products that are volumizers that take hair and give it more volume because each individual hair shaft looks bigger. So that there's a lot of those things that don't necessarily grow hair, but make the hair look better. So I think that I never look at the non-surgical alternatives as standalones. I always look at them, if someone has significant hair loss, that you want to pull out all the stops. So if you're going to go through the trouble of having hair transplants, you might as well do the Rogaine, you might as well do the Propecia, you might as well do these other treatments that we've talked about, because the outcome is what you're after. And so if you're willing to go that far, you might as well do it all. And then again, they're there for those people who feel that surgery is not right for them, and at least you have some alternative.